The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV. You before we, at USV.
USV, your reliable healthcare partner.
Welcome to the show, Beat Diabetes, the first of a 4-part series. If you are an Indian, it's very likely that you have a close friend or a relative who suffers from diabetes, or you could have it yourself. Diabetes has become such a worrisome problem in India and so widespread that it affects everyone directly or indirectly. To address this problem of growing diabetes in India and how to overcome this rising epidemic, we have a panel of experts for you from across the country today, and we hope they'll help you lead a better life with diabetes. To my left is Dr. V. Mohan. Dr. Mohan is one of the pioneers in diabetes research in India. His work on the epidemiology of diabetes is well recognized. He is from Chennai. Next to him is Dr. Shailaja Kale, who is a leading diabetes researcher from Pune and has done tremendous work on the genesis of diabetes in India. We have Professor Arvind from Bangalore, who heads the Research Society for Study for Diabetes in India, the main body of diabetes specialists within the country. And we have Dr. Kaushik, eminent endocrinologist from Calcutta. Let's talk about diabetes in India. We know that diabetes is increasing in India in a big way. You know, we also know that the numbers are somewhat staggering. We read all kinds of figures. Let's hear it from the man himself. Let's hear from Dr. V. Mohan. What actually is the prevalence of diabetes in India?
Thank you, Amrish, and thank you for inviting me to this show. So, yes, you're right that diabetes has reached epidemic proportions in India, and according to the latest figures put out by the IDF Atlas of Diabetes, which is considered the most reliable database, in India today there are 70 million people with diabetes, and what's more worrisome is that there are 80 million people with pre-diabetes. These are people who eventually develop diabetes. If you're 50 years old and you live in one of the metropolitan cities in India, 40% have diabetes and 35% have pre-diabetes. That means more likely you are to have either diabetes or pre-diabetes than to be normal. The last point I want to say about the epidemiology is that earlier it was considered as a rich man's disease, an old man's disease. Today it's coming to young people, poor people, and even in the rural areas. So we truly have an epidemic of staggering proportions in India today.
So actually it seems we have more people with abnormal glucose values than normal glucose values. And
in the cities at least.
Yeah,
yes.
so in the cities, and I think a time will come when we'll be looking for why is this person not a diabetic instead of worrying about why he is a diabetic.
True.
So what really do you think, Dr. Kale, would be the reason? Why has this happened? These are really stunning, staggering numbers. Why do you think it's happened?
Diabetes is growing across the world. In every country this is the problem. But if you take India, which is a major part of South Asia, it is growing in really bad proportion. We all have a genetic tendency to get diabetes. On top of that, the major problem is our lifestyle. Day-to-day lifestyle as well as the lifestyle which has happened in last few generations. There is a drastic change which has happened, and our daily life, our eating patterns, our physical activity, our stress level, the type of work, everything is changed over generations plus every day. So this bad lifestyle is actually pushing all Indians towards getting the diabetes.
It's also, we are noticing a change in the profile of diabetics, yes, right?
Yes.
We're noticing a change in the, when we were students, for example, or residents, we hardly ever saw a 22-year-old, 23-year-old walk into your clinic with type 2 diabetes, the usual diabetes. Yeah. You want to comment on that, Dr. Pandit? You have a lot of experience in this area. What about diabetes hitting people young?
Yeah, this is certainly a very important point of concern. In fact, many times patients drop into our clinic and we tend to believe that the father who is having diabetes, but it is the other way. is the father who is getting his son to get treated for diabetes. And this is something very worrying point. This is primarily happening because of two reasons, as Dr. Kale had said, that despite the fact that you are having the same sort of genes for the last so many generations, it is the lifestyle which has undergone a complete change. And unfortunately, this change is seen predominantly mostly in the young population who fall prey to this disease because the lifestyle change is so much in that particular population. They walk less, take recourse to various gadgets, I mean have got tremendous degree of stress levels, which is changes which that we see in the westernized sort of lifestyle in India today, and that is what is driving. That is a major driver for.
So what you're saying is really that it's lifestyle. So that actually gives a lot of hope. That gives hope, because if genes are at fault, there's not much you can do, right? So the thing is that our genes are the same, and we've messed it up, you know, by changes in our lifestyle. And so, Dr. Mohan, want to throw some light on the genes part of it once?
Of course, genes are important, but then I would put it to you, when we had 2% diabetes in 1970s and 1% in the rural areas, and then it goes up tenfold over 30 years. Did our genes change in 30 years? Suddenly we had a genetic makeup which changed completely. That didn't change. What changed is the environment. So we do know through our genetic studies that Indians do have some genes which are a little different. The strongest gene, TCF7L2, which has been reported in Europe, is still the same in India. So that doesn't change. That's the, I would say, 80% of the biggest gene for type 2 diabetes. But if you look at all the minor genes, they are different in different populations, and in India also we have about 6 genes which we publish in a paper in Nature Genetics showing these 6 genes are only in Indians. But does it explain the epidemic? No. So while these genetic factors are there, exactly as Dr. Kale said, on the background it is there, what changes the environment? And as you very nicely put it, I think if it's all genetic, you're just doomed to get it. You know?
Yes.
That is only in a very small subset of people, like the maturity onset diabetes of youth, MODY, where there's a monogenic defect and one gene is affected. That will keep on going from family to family. You cannot change it also. You're born with it. But that's like 1% of all the people that we see. 95%, 98% is the type 2, which I think can be controlled and prevented, as we'll discuss in the rest of this program.
Sure. I think we come to you, Dr. Arvind, and you know, we're talking of preventing diabetes. The problem is we don't even know if a person has diabetes. So one big challenge in diabetes, as we all know world over, is that there are lots of people who are undiagnosed, you know, who don't know they have diabetes. So why are people undiagnosed, and what can be done about that?
I don't have the exact figures when it comes to the people who have diabetes but who have been undiagnosed, but I can quote from the IDF Atlas, 7th Atlas, which clearly tells us that there are 193 million people with diabetes but do not know that they have diabetes.
In the world.
In the world,
yes.
Okay, now that's in the world. Now in India, Dr. Mohan quoted that we almost have 70 million people with diabetes. Now if you extrapolate the IDF data, we can say that probably about 30 to 35 million Indians probably have diabetes, but do not know that they have diabetes. And I'll also add to what Dr. Pandit was talking about, along with the lifestyle changes, it's coming early today. There is also a tremendous increased levels of stress among the youth of India. Now this stress, whether it is related to education or what they have to become.
In your city, they're probably working to American timings.
I know, that's one of the things. Working at different timings, night shifts, and not adjusting to the thing. Probably people are all in a race. You know, in an effort to have a better tomorrow, people are forgetting to live today. And that's exactly what's happened.
Just to put that in perspective, most studies across the world have shown that the most stressed profession is medicine. Doctors are the most stressed professionals of all. So you're not alone there. Doctors are also struggling with stress. And Dr. Kale, just before we go for the break, I would like to know really, how does the clinical pattern differ? Is it different? I mean, is the clinical profile of a diabetic you see here different from what is described in the West or Western textbooks? You want to elaborate on that?
Answer is yes. And though the treatment remains same across the world for all people with diabetes, but in India there are some peculiarities, and a person treating that, or everyone should know these peculiarities. Like we get it very young, maybe 10 years younger, and in general these lifestyle diseases are associated with obesity, like high BMI, which we don't see it in India. So people may think, I am not obese, I may not get such lifestyle disease like diabetes, blood pressure, heart disease. That is not the case. So we have it's commonly described as a thin fat Indian, and we have more fat across our tummy, and so that fat sits around pancreas, liver, and that makes you more prone. Another thing very particular about its very rapid progression. So diabetes becomes more severe early in Indians. We have more heart disease. Our people have more kidney disease. So in general, getting it at a young age and more kind of a severe. So we need to prepare ourselves to beat diabetes and all its complications right at the beginning, right from the young age. So it is a bit a kind of a more complicated thing, and coming it at a younger age. That's the difference between Indian.
Coming at younger age actually introduces another element that you live with it longer.
So the
chances of getting the complications are
much more.
I would like to say a small thing here. When we are talking about young onset diabetes, recently we had a study published from India where I and Dr. Mohan have shared the paper. We found that almost 50% of newly detected diabetics are below the age of 40. Now this is something which is very, very disturbing in India, something that we did not see.
Yes, absolutely.
And close to about 70-80% of them are overweight, and about 25% of them already have hypertension. Now this is exactly what Dr. Kale was saying, that lifestyle changes have to take an important role if you want to prevent diabetes in India.
So we've learnt a lot about diabetes from our experts today, and the silver lining is that really it's mostly lifestyle, and if we can define this better and work on this, we can prevent our youth from heading towards diabetes and prevent those who have diabetes from getting into trouble with their complications. We'll take a short break. Stay tuned for more. We have lots more coming up.
The homes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as USV, you before we, as USV.
USV, your reliable healthcare partner.
Diabetes in India is increasing because of lifestyle, and many of us have patients, most of us have patients who simply by managing their lifestyle well could manage their diabetes for years and years together, 30 years, 40 years also. And those who come early in the course of diabetes, if they're really good with their diet, exercise and other measures, can sometimes even reverse their diabetes for many, many years. So there's lots of good news, but we need to really take action, and now. Dr. Mohan, we've been talking of urban diabetes and, but what's happening in the countryside? And we know that there is some less sort of prevalence of diabetes in rural areas, but do you want to elaborate on that?
As of now, as we speak, yes, it is true that in the rural areas, it is a little behind the urban areas. Rural areas are always 10 years behind us. So why did it increase in the urban areas? Because everything changed here. In the rural areas, the lifestyle changes a little, progress is a little slower pace, but it's happening. And India is not uniform throughout. So if you take rural Tamil Nadu, for example, the prevalence rates of diabetes today are 10% in rural Tamil Nadu. Whereas you take rural Jharkhand, where we have done the ICMR INDIAB study, it's only 3%. If you take the northeastern states, Manipur and so on, the rural areas are having much lower prevalence rates of diabetes. But whatever is happening in urban areas translates into rural areas within a short period of time. Mechanization comes there. They are not plowing the field anymore. They are sitting in a tractor. They can get loans. All the things that the junk foods that we had here, now the markets move into the rural areas trying to capture the new market. So the same mistakes that we did in urban areas will repeat in the rural areas. But to me, this gives a golden opportunity, window of opportunity,
for intervention.
Because the lessons that we have learned, why did the prevalence go from 2% to 20% in the urban areas, and what could we have done to prevent that? I don't think we should allow history to repeat itself. And so right from the beginning, if you bring the for example, in some of the rural areas where we work, the concept of walking is unknown, because they have not done leisure time physical activity. They only work in the fields. Why should I walk? But as their life changes, we'll have to tell them, what you can eat healthy, and we'll discuss that later, how healthy eating can continue and how the exercise levels have to be kept up, then they can repeat the same thing from happening what happened in the urban areas.
Dr. Pandit, we've also heard patients coming in, and, I mean, you know, for the benefit of our viewers, would you like to explain when they say, the doctor told me I don't really have diabetes, but maybe a little bit, you know, maybe I have borderline diabetes. What is this borderline diabetes, pre-diabetes story?
Yeah, as Dr. Arvind has said that we have a good number of people who have got diabetes, who knows that they do have it. There are a large chunk of people who do not know that they have diabetes, and there is another huge chunk of people who have what is known as pre-diabetes. Then what is this pre-diabetes? Well, we'll have to appreciate this fact that diabetes, that means high sugar, and normal, they are not separated by a number, they are separated by a zone. Let me give you an example. Well, for fasting glucose, if it is more than 126, we call it diabetes. The fasting glucose, if it is less than 100, you call it as normal. Then what happens to this who are between this 100 and 125? They are known as pre-diabetic. What is the importance? The importance is terrific in the sense, first of all, they have got a very high chance of developing diabetes in the years to come, in a short while, and at the same time they run the risk of other important problems like, say, heart attack, like hypertension, and so on and so forth. So pre-diabetes should not be looked down upon as a very simple problem. In fact, in these people, diabetes can be prevented to a large extent, which is very important.
So pre-diabetes, that is screening for blood glucose, is important, and we'll come back to
because
who should
it
be screened.
is asymptomatic.
And there's no symptoms there, and if you intervene at that point, you will prevent a lot of people from actually going into the danger zone of diabetes, and so that they'll remain healthy all their life. So I think that's a very, very important niche. Now we've talked about diabetes not producing symptoms, which is actually in a way not such a good thing. But if there were symptoms, very briefly, Dr. Arvind, can you tell us what are the symptoms of diabetes?
See, the classical symptoms of high blood glucose is usually increased urination, thirst, weakness, sudden loss of your body weight. But these are very classical symptoms. And in India, unfortunately, majority of the patients do not have these classical symptoms. That is why when you ask me a question that how many people are there without knowing that they have diabetes, there are close to 35 million who have diabetes but don't know, mainly because it is asymptomatic. In India or anywhere in the world, only when something goes wrong with the body, you go see a doctor. Here, nothing is happening to you. People are walking around with...
It's a silent killer.
Yes.
It's a silent killer. People are walking around with blood sugars of 300, 400, no symptoms. High blood pressure, no symptoms. High cholesterol, no symptoms. Even after diabetes comes, if they have a heart attack, majority of them have no symptoms. Waiting for symptoms to occur in diabetes is like writing a letter to a person with no hands and waiting for a reply. So diabetes never speaks. I think we have to go ourselves and check.
Yes. So since we talked about the devastating consequences of diabetes, that can happen, but should not happen actually if you manage your diabetes well. Would you like to just outline for us, Dr. Pandit, what are the sort of long-term complications of diabetes that could happen?
I mean, if somebody do not treat the diabetes well, they are negligent, do not care for it, and it then goes on for a long period of time, leading to some problems. Some of the problems are pretty well known, like something related to the kidneys, but unfortunately diabetes affects almost any organ system of the body. True. Especially the heart, like heart attack, heart failure. Some people can have a problem with the eyes, and some people can have problem with the nerves also. So it is very important that treatment should be initiated early and they should be checked.
Lot of aggressive things which needed to be done in the early years are exactly done very lightly by people as well as by treating doctors. I will say
sometimes the first few years of diabetes are critical to long-term complications. That's the golden period where you can intervene. So we've talked a lot about this, and we are coming towards the close of this session. Last question to Dr. Mohan and then to Dr. Kale. So Dr. Mohan, who should get screened? We are like, I don't know, billions of people.
Ideally speaking, everybody should, because I said at age 50, if 40% have diabetes and 35% have pre-diabetes, naturally at that age everybody has to be screened. But in India, I don't think you should wait that long. If you have a family history of diabetes, meaning that your father, mother, brother, sister, anybody had diabetes, you should start screening at age 20. If you wait until you're 30, 40, Dr. Arvind just mentioned 50% people already got it before 40. So if you wait, you're going to miss 50%. If you're overweight, If you are under stress, if you have blood pressure, if you have lipid problems, cholesterol, triglyceride problems, if you are unhealthy, you don't do exercise, all these are high risk individuals, and then if you are pregnant, of course, every pregnant lady in India should undergo a screening to rule out gestational diabetes, which is another form of diabetes.
You know, we're talking of the burden on the individual's health. We've talked about numbers. But, you know, in a growing economy like us, can we afford to manage diabetes? What is the economic impact of diabetes?
It is not the cost of taking treatment for diabetes that is expensive. You can still manage with about 5,000 rupees per annum, which is reasonable. Okay, it may go up to 10,000 in certain places, maybe when you use some expensive medication. So taking care of diabetes is not expensive, but if you don't take care of diabetes, the complications that you get into can be anywhere 2 to 20 times expensive to treat the
complication. Not to treat diabetes than to treat diabetes.
So we always tell patients that treating diabetes is like buying insurance.
Exactly.
If you treat your diabetes well, you will prevent all kinds of things later in life, kidney transplants, eye lasers, coronary bypass surgeries. So we really, this little expense or whatever expense you're able to do, invest it in your health. That's really important. And coming to the final message, what exactly should people do? We'll discuss this more in subsequent episodes, but really, what can generally people do to prevent?
I think as usual, we heard a lot of bad news from the doctors. That's the doctors are blamed for. But we do definitely have some good news for all of you, that diabetes can be prevented, it can be postponed. 10,000 steps every day, walking. You can use gadgets like steppers, step counters, Apple phones, everything. Then any good physical activity, exercising, running, jogging, playing badminton, or anything which has more physical activity will help you to keep you away from diabetes. We eat 70% carbohydrates, which we need to reduce. So reduce your routine rice, chapatis and bread, increase vegetable, fruits, increase proteins, pulses. And the proteins, eggs, fish is, so increasing proteins, reducing rice, chapatis kind of a diet, decrease fats, no fried food. I think the change in the choices of eating should also come from the change in the cooking.
So we end on a positive note while realizing that diabetes tends to overwhelm us. The numbers are staggering. It is true that by taking small steps each day, we can actually reduce our risk of diabetes and lead a healthy life for many, many years with the diabetes. Let's all then join together. Let's beat diabetes. Thank you very much.
The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we at USV, you before we at USV.
USV, your reliable healthcare partner.